And you can see when you look up close how the nail is coming around and it goes straight down into the skin. So when I push on it, it gives her pain on the side of the toe. In order to get rid of that, I'm gonna have to cut the side of this nail out. I'm gonna take this sliver right here, and that's the section of the nail that's actually cutting into the skin. So I'm gonna take that whole section out, and back here I'm gonna put a chemical so it'll never grow back again. If I just clip it back, and I were to clip it halfway to about right here, as soon as that nail grows out, it's still gonna dig into the skin, it's still gonna be a problem. So I'm gonna stop it from growing right in this section by putting the chemical there, and that way any nail that's produced, it will stop right here and it will come out straight. The skin will grow back to the edge of the nail, but she'll never have an ingrown nail again. So I've already numbed her up. I'm gonna wrap her toe right now with a tourniquet. And we use this Coflex as a tourniquet. I can wrap it very tight around the toe. It also exsanguinates the toe. That's getting rid of the blood from the toe by pushing it out. So that way there's relatively little bleeding. We don't want any bleeding with this because if it bleeds, it'll dilute the chemical that I'm using. So I'm gonna clip this back on the edge of the toe and pull this back. And the patient seems to be very impressed by this too.
Yes, I was wondering how you were going to cut it with that around it.
And now we can see it real well. And what I'm gonna do, first I'm gonna free the nail at the eponychium. The eponychium is really what we all call the cuticle. It's this area right here. And now I'm gonna go underneath the nail. And as you can see, I can free it this way as well. And I'm going down into the nail bed at the base of the toe and freeing it up. And now I can easily cut through with an English anvil. This is the tool that I'm using. This is called an English anvil. And I can see right here, you can see the junction where the nail is straight and where it goes straight down into the skin. And right at that junction is where I'm gonna cut it because I want this to grow out straight. So I'm gonna take a nip here and then we're gonna nip it all the way back. Now I'm under the eponychium and I can actually feel it. I'm doing this a lot by feel under the eponychium here. And now that it's free, because I've already freed it up, you can see I'm gonna go into the side of the nail. You can see where I've freed it up and I can slide this down under the eponychium, clamp my hemostat, and as I turn and pull, I'm gonna be able to pull that piece of nail out. And you can see, and I'm gonna slowly pull this out. And you can see all that dead skin coming. That's all callous skin. You see that piece of nail? Nice big chunk of nail.
Wow.
That's it right there. That's the chunk of nail right there.
No wonder it hurt.
And she's gonna put this under her pillow for the tooth fairy. Maybe the tooth fairy will think it's a tooth.
Oh, yeah.
Maybe not. Okay, now what we're gonna do is we're gonna make sure that this is cleaned out here on the side of the toe. And all I'm doing is getting some of this dead skin out of here. And a lot of that is calloused tissue because this has been growing in for so long. And I'm going underneath the nail here and making sure that's all out. Some of it's by feel and some of it's by sight. Now I'm gonna use sodium hydroxide, which is a weak acid, it's a strong acid, weak base, and we're gonna burn it in the nail matrix. That's the area where the cells are that produce the nail. And as you can see, I do this for about 10 seconds each stick. It's not exact, it's just a matter of watching it and seeing the tissue turn white. So it's about 10 seconds. And what this is doing is killing these cells. We don't want it to produce any more nail. This also causes a reaction and your body will start draining fluid for about 3 weeks after this is done. So we've done 2 sticks. We're gonna do 1 more stick for about 10 seconds. And again, I'm looking at it and you can see, if you look deep in there, you can actually see right in this spot here where it's actually burning the nail matrix cells. And we want to flush that out, and we're going to flush it with vinegar and water. This is our flush here, and that dilutes it. Now it's flushed out of there. And then we're going to put a dressing on it in just a second. So I'm going to remove my tourniquet here. Just unwrap it. And it's not bleeding that much because the chemical will also cauterize it a little bit too. I'm going to put this in here. And what's going to happen when this heals, I can show you that this skin is actually going to move over towards the side of the nail just like that. And you'll have a straight edge to that nail. You won't be able to tell anything's done after about 4 weeks or so. So now we're going to wrap her up. This is a real easy recovery that's not really painful afterwards. I'm going to put a wrapping on this. And she likes pink, so she's going to get pink. And that's it. She's going to return in a couple weeks. And I'll take a look at how it's progressing. We'll clean off some of the tissue. And then 2 weeks later, she'll come back. We'll clean the rest of the tissue off from the drainage. And she'll be on her way.